there, it's me, Cherry from RAB Academy, and welcome back to the series Hoitajat, suomessa. And today, we are going to hear from Sharlen, sharing some of her experience dealing with unexpected situation with patients, especially with those who have memory disorder. It's important and requires lots of patience and understanding. So, let's hand it over to Sharlen to hear her stories.
Moi kaikki! My name is Sharlen and I'm a practical nurse from Finland. And today I'm going to talk to you about the unexpected situations with patients. As we all know, working with the elderlies can be very diverse. It can sometimes be challenging, but also incredibly rewarding. Every day is different and there is a lot to learn from the elderlies. I mainly work with elderlies who have memory disorders. Memory disorders can sometimes change a person significantly, and the symptoms manifest differently in different individuals. Even ordinary situations with people who have memory disorders can be unusual, unpredictable, and even funny. Today I will share a few examples of different situations I have encountered and that one might face, so let's get into it. One thing I have noticed when working with elderly people is that they gossip quite a lot, and gossiping is also quite common. Many elderly people enjoy gossiping and are quite curious, whether it's about the neighbor's grandma's food, the caregiver's activities, the visitors that have come by, or anything else. They love to chat. And since we are dealing with people with dementia, the stories can change significantly as they are passed along. And because of this, I myself have heard rather interesting stories about myself from these elderly patients who have memory disorders, and the caregivers, they have gossip too. The downside is that sometimes the gossip can be totally false and may cause some harm or distress in the unit. But these situations are always clarified and addressed. However, most of the time the gossiping is totally harmless and amusing to listen to. Sometimes you can even learn new things about yourself. One interesting observation that I have made is that people with memory disorders, just like normal people, just like healthy individuals, have their favorites. So favorite people and favorite caregivers, which is understandable and completely normal. However, in this case, with the elderlies with memory disorders, their preferences can sometimes depend on something as small as which side of the bed the caregiver is standing on. For example, in situations that patient requires assistance from two nurses, it is often the case that for some reason one nurse is considered as the good nurse and the other one is considered as a bad nurse. It's almost like good cop, bad cop dynamic. Interestingly, this necessarily doesn't depend on the nurse themselves, but can be influenced by something as simple as which side they approach the patient from. In these cases, it often comes down to luck and the patient's mood. Naturally, as nurses, we must always remain calm, patient, and neutral in these situations. The approach is usually to let the so-said good nurse take the lead, and while the bad nurse assists when needed, ensuring that the resident remains as calm and comfortable as possible. Respect towards the patient, regardless of their illnesses or mood swings, are always the top priorities. The goal is to create an environment where the patient feels as safe as possible. Even a person with memory loss can sense and feel more secure when they see that the nurse who is approaching them is calm and has good intentions. There are also situations where the patients can experience strong delusions, seeing, hearing, or even feeling things that are not there. In these cases, the response depends on the situation and the individual. Sometimes it's best to go along with the residents, with the patient's perception, and reassure them in a way that they feel calm. An example situation: there's a patient at bedtime who is in their own bed and they believe that the bed is filled with cats, and they ask the nurse to feed them because they are worried that they are in hunger. In this example, the nurse might say, "Oh, don't worry about it, I will feed them and you can go back to sleep peacefully." This way, the patient feels reassured even when it's not real. However, there are also cases where the patient's delusions are so strong and intense, and the patient feels like they are in serious danger. For instance, a patient can cry hysterically, panic, believing in that someone is coming to harm them. In these situations, the nurses try to reassure the patient that no one is coming for them and they are safe. If this does not help to calm the severely distressed patient, doctors have prescribed sedative medications that can be administered when needed. These medications help stabilize the patient's mood and prevent them from experiencing a prolonged fear and panic. If these delusions occur frequently, persistently, and significantly disrupt the patient's life, a doctor assess and consider appropriate treatment options, such as adjusting the medications. Additionally, certain infections can cause these symptoms in elderly people, so that they exhibit unusual confusion or disoriented behavior. In such cases, the underlying cause of the atypical behavior is investigated. Every situation is different, and each of the patient's cases are carefully assessed and managed using the most appropriate approach. That's all for today. Thanks for listening and moi moi! Nähdään taas!
Hey, I hope those stories and tips were helpful for everyone watching. And remember that every situation is unique, and patience and understanding are the key. Thanks for tuning into Hoitajat suomessa. Don't forget to like, share, and subscribe for more content. Kiitos paljon. See you next time. Moi moi!